Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department here at MCHD. I'm talking to Destiny Lankster. She's with our Data Science Team. Destiny, how are you?
I'm good. How are you doing today?
I'm doing well. Now, we're on this Wellness Wednesday, we're talking about a very important survey that the health department is putting on. It's called the Community Health Assessment. So tell me a little bit about what is this survey for?
So the community health assessment is for the health department to be able to directly get information from the Mobile County residents about their health needs, what services, what resources that they feel like the community needs. We want to take that information and use it as part of our internal planning, as well as working with our partners to be able to see what are the priority areas for people and how can we strategize to make sure we're meeting those needs.
So it's sounds like a good feedback, a good feedback loop there to get some information. So why is this particular assessment so important right now?
Well, it's very important because I'm sure everybody knows there's been a lot of changes going on, within the community and people just wanting to see more accountability in the way that we're doing things. And I say that to say we really want to know like exactly what should we be prioritizing, what services should we be
Mhm.
using, where should we be turning our attention to. We want the work that we're doing to be tailored and focused on the community.
I like to take surveys. I like them. I like to be able to have input and feedback, and I know that this is a valuable tool. So, but um, I don't like lengthy surveys. So how long does this survey take?
So this one is about roughly 15 minutes or so. Look, I understand. So we do about, just really appreciate people taking the time and the patience to actually sit down with our survey and to be able to like go through each question and try to answer to the best of their ability. Um, it will give us a lot of great information. These questions were created we did a survey with our internal teams to kind of see like, hey, when you're talking to your people, what are some of the things that you're seeing or need more information about? We also asked some of our external stakeholders the same questions since they're also sort of boots on the
Mhm.
ground talking to the community. So even though it's lengthy, about 15 minutes, a lot of it is really good information. Will also help answer a lot of questions for a lot of people, not just the health department, who are doing planning and providing resources.
Actually, 15 minutes is not that bad.
I don't
It's
know,
not
like, yeah.
it's not a lengthy amount of time. I'm sure scrolling on social media, you've passed 15 minutes even before you even
Very
realize
quickly.
it.
Yeah.
So yeah, that's that's digestible. That's not bad at all. So I've taken survey. I know where it is. We'll talk about that in a second. So, but who in the community can take this survey?
So we want anybody in the community to be able to take the survey, adults, teens, because it's very important. We provide a lot of resources to a lot of different people, seniors, everything like that. So anybody can really take the survey.
Now, also people want to know, do they get paid to take the survey?
Unfortunately, we cannot provide any payment, gift cards, and incentives to take the survey. So once again, that's why we're like really appreciative of the people who are able to take the
Mhm.
survey or want to take the survey and engage with us. Like I said, the information will be very valuable into what we can put back out into the community. So even though I can't pay you directly to take the survey, the goal is that that information will be able to improve resources in general for everyone. Um, and hopefully, it might be you, it might be a family member, a friend, somebody. We do a lot of things here at the health department that I've only been here for 4 years and I'm still learning about a lot of the things that we do.
Mhm.
So it'll be a very helpful survey.
Yes, and I think you talked about it, the intangible benefits
Yeah.
in the long run for the community far outweigh any type of short-term incentive. So, yes, it's for the betterment of the community. So, when you get all the survey results, so what happens? I know you're in data science, you tabulate all that type of stuff. So, what happens with the results?
So we're going to close the survey August 24th. And when we take all of those results, First of all, it's going to go into what's called a community health improvement plan or a CHIP.
Mhm.
And so that chip will take all that data that we, the data science team, will compile and put together. We'll reach back out to our team, some of our partners, and try to see like where are the priority areas and what are some strategies that we can use to tackle those issues. Also, that community health improvement plan, though, it'll talk to a whole lot of other plans that we have within the health department. It can affect our strategic plan for the whole entire health department. It can affect our performance improvement plans, where we need to improve, what projects we need to create to make those improvements. It'll also help with workforce development.
So let's talk about the survey in detail a little bit. Available in other languages.
Yep. So we have the survey in English, Spanish, and Vietnamese, which are two other languages that are predominantly spoken here in Mobile County.
And we thought about that way in advance. So you already got that stuff set up. That's
Yes.
awesome. So um, let's tell people where they can go. Click on the link, follow it, how to take the survey.
So yes, we have our survey posted on our main website. There is a banner. It'll be the first thing that you see. There is the link to the survey. There's also a news release that'll have some of these additional details that I'm telling people now. We also have our community tools section of the website, which includes the survey and some other great digital tools and resources and dashboards that the community can use. We'll also be putting up flyers, handing out postcards at our outreach events, working with our partners. So you may see things on their social media. So this is a community-wide engagement that we're trying to do. Um, so yeah.
Yeah. Yeah. So start, like you said, the website, which is mchd.org, should be the first thing you see up at the top, across the top when you go there. Or also some of our social media channels will be periodically running multi-language information there just to make sure that we've gotten everybody, because not everybody looks on social media every day.
Right.
So we want to make sure we're covered. So in closing, Destiny, what else do you want to add, or what should we tell people, uh, particularly about about this survey?
I mean, I just want to add, like I said, surveys, they're a great way to get your voice out there so that you can be heard. This is like I said, a community-wide engagement. We want everybody all over the county to be able to take this survey, to be able to benefit, or like I said, family, friends, those intangible benefits. Um, so I think that is a very important survey. I'm excited because this is, I think, something fairly new or updated that we're trying to do here at the health department. We really want to
Mhm.
build our engagement. And if there's anybody who does, hey, I may want to try to partner or hand out some postcards, you are more than free to email the data science team at datascience@mchd.org. We definitely want to hear from everybody and try to build up those partnerships within the community.
Mhm. So let's just recap real quick. Uh, you can start by going to mchd.org, should be the very first thing you see at the top, and the close date again for when the survey closes down for you to start tabulating the data is what date?
Um, so we're going to close the survey August 2024, and then the goal is to post the results. And I said August 2024, August 24, 2025 is when the survey closes. And then we hope to have the results posted in early 2026.
Okay. All right. Well, Destiny, thank you for this information. Uh, we're hoping that people will want to have a voice in, take part in this health assessment. It is for the benefit of the north part of the county, the south part of the county, the east part of the county, the west part of the county, the whole entire county. So, Destiny, thank you very much again for being on Wellness Wednesday.
Thank you for having me.
Bye bye.